me just, once it goes live, we begin. Yeah. Yes. Once it goes live, we begin. Yeah. Okay. Yeah. Okay, friends, we are truly grateful and thankful to Dr. James Thomas, who is here with us to talk to us. We are living in unprecedented times, and we are facing a challenge like never before. This COVID scare, which is now surpassed the previous record also. And indeed, we are absolutely, scared and worried about what the future has in store for us. And I'm sure there are many questions we may have regarding, which vaccine to take, and what is this new strain, and what are the complications, and what other things that we need to take care of. What are the other cautions that we need to heed? So today we have with us Dr. James Thomas, who is an outstanding heart surgeon, former Vice Chancellor of DY Patil University, having performed over 16,000 heart surgeries. And over and above, besides that, he's an excellent human being for those who know him personally, very helpful and a great man of God. So we are very happy to have him. I hand over this time to Dr. James Thomas to begin his talk. Thank you so much. Welcome, Dr. James.
Uh,
Go ahead.
Thank you, Pastor Abhijit.
Yes.
We bring you greetings to your church members and others who are going to be watching this program. I appreciate you asking me to speak this evening. We are grateful to the Lord that He is there to protect us and strengthen us. Yesterday there was a Lenten prayer meeting at the St. Paul's Mahatma Church, Washi, and I was speaking. Can you hear?
Yes,
Are you okay?
yes,
Yeah.
We can hear.
Yeah. We talked about how Abraham was the one chosen of God, and he was led by God, and he continued to be faithful to the Lord in unwavering capacity in all situations. So was Paul. Paul was put in the prison and beaten. He was, he was accused. And he went through all that with unwavering faithfulness to the Lord, who was his master. And he also encouraged the Corinthians, to stay true to the word of God and not stay away from the false teachings. So, biblical times also have seen difficult times. These are depressing. They are, despairing times for. We have treated many patients now in DY Patil. Right now, there are more than 100 patients who are admitted in the ward as well as in the private room and in the only the COVID part. Leave alone hundreds of the others. And but one good thing about the thing is that we have gone through almost a year now with this COVID infection and etc. And the worldwide, everybody has been concerned about it. One good thing about it is that 97% of the people have recovered from the infection. This is something very heartening. The mortality, the fatality rate has been very low, 1.3, 1.3, etc. for India, which is good. Now, there's a recent surge again. This coronavirus affects the body, so it enters through respiratory tract, and so that's why everyone has been asked to wear masks and keep the distance and wash your hands and keep personal cleanliness, etc. Now, the more than 97% of the cases, when it recovers, it means that the infection has become milder, and we see a lot of people who are positive have a few symptoms, and those with no symptoms or few symptoms can still stay home quarantined, etc., rather than go to the hospital where you can get reinfections also. So which is a good thing to happen.
Yeah.
The now we have seen a surge now in everyone has been watching the TV. Maharashtra has been one of the forefront of our cases, and when we have every day 53,000, 35,000 is in Maharashtra, and Bombay alone has got 5,000 cases, one of the largest right away. So there is a large amount of people affected. Tamil Nadu, Kerala, and other places are the ones which are the next ones. Now the testing, 2 we have done a lot of testing and it's happening. I think 238 million tests have been already done. That's a large number. That's 23 crores. And what is need to be done is more testing, so that people will come we come to know, and because there are a lot of carriers around, who have no symptoms or walking around, who probably are positive. We do not know. So the only way to know people who are positive is to test them. Right. Why test them? Because there is something known as a herd immunity. Herd immunity is when the large number of people are affected or treated, and that supports immunity system for the whole community. That will take a lot of time to happen in India. Things. And there's a lot been fear about vaccinations now. Vaccinations, the highest number of vaccinations now has happened is in UK. 45% have been vaccinated. Okay. And US it is 37% have been vaccinated. Oh. And India is, very few, hardly 4%. We have achieved 5.5 crore vaccinations, but we have a large population of 130 crores, which is a thing. But that's a very good thing that has happened. Now people ask which vaccine, See, whatever the vaccine, whether it is 98%, 60%, 78%, you need to get vaccinated. And take the benefit of even 70% benefit is better than no benefit at all. Right. The Pfizer is the largest, vaccination that is being used in USA, and Covishield. There is the other one is called the AstraZeneca Oxford vaccine called Covishield, which is produced in Pune Serum Institute. Yeah. That's what we are having it in Maharashtra, and I have taken that. I have taken the second dose. It's more than a month and a half after my second dose. So that has been the common vaccine here. The other vaccine is Covaxin, which is Bharat Laboratories made them, and mostly North Indian people are using that. Prime Minister took that Covaxin because it was available in All India Institute that time there. So the newer vaccines are still coming up, and other labs are coming. The effectiveness of the Pfizer vaccine in America is probably, they are claiming 80-90%, whereas this AstraZeneca, the Covishield, which we have now available here, is almost 72-75% efficacy is expected. And the other Covaxin is little less, maybe 7.
Yeah, the sound.
What is important is whatever is available is what you need to take. Pfizer vaccine will not come here because it needs a stricter cold storage and cold transportation systems. Right. But Covishield has been easier to get, and it's manufactured in Pune, and we've been exporting a lot of vaccines to other countries also. Right. Now people ask why there are some incidences, after vaccination, somebody had died, somebody had allergic reaction, etc. When
sound.
Crores vaccination has been done, and the number of people who died here and there is nothing. And also maybe they are older people, they probably already had a heart problem, so they already had diabetes uncontrolled, or maybe stroke or something, which was probably a lot of things we think it is all incidental, it has nothing. So do not be worried about taking the vaccine. Right. People with allergy, asthma and all always ask whether any difficulty in doing that. I don't think so. There's nothing. It's a 0.5 ml vaccine which is given to the intramuscularly, and it's a small dose. And the second dose we all took after a month. Now the thinking is that it should be, the second dose should be after 6 weeks to 8 weeks after the first dose. You must take the same vaccine, first and second also. How do you treat a patient who is positive? How do you know where the patient is positive? A person who has got fever, unexplained sore throat, body ache, and differentiation in taste in the mouth, or feeling uneasy and very, very weak, etc. So probably some of the symptoms of this. The only way to know is to do the RT-PCR test. They used to do the rapid antigen test, which is not very clear. About 30% only it is result. So RT-PCR is a swab taken in the throat. From the throat, one swab and one in the nasal swab, and then you get the report the next day. Right. And if it is positive, what do you do next? If you have not much symptoms, you have just been tested positive, you stay home, quarantine, and have a separate room for you and a bathroom or whatever it is. Don't share your food, the cutlery, etc. And keep a little bit of quarantine from other family members for almost 14 days. And this is what is advocated all over. And no need to hospitalize if you do not have any symptoms. Right now, I have some private patients who are admitted. One had severe sore throat and cough, etc., and we had to admit him. And the other guy had severe body ache, etc., and he was symptomatic, so we admit them. Then we do what is known as HRCT. It's a CT of the chest. Chest shows. Normally, the lungs are clear in the CT, but those with COVID will probably have a lot of white patches in the HRCT, and it is graded within 25. One patient who had 19 out of 25 means he's got a severe infection. 12 out of 25 means moderate infection. Below 7 means not much. And if you have an HRCT clear means you don't need to give some certain amount of injections. Sure. We do also some blood tests. One is CBC, blood count, which is, the lymphocytes, which are the white blood cells in the body. Normally it's 24, whereas in the COVID patients, it comes down to 7, 8, 9, etc., very low. Yeah. Then there are other tests called D-dimer, CRP, IL-6. If they are higher, we start these people on what is known as injection remdesivir. This is a newer type of injection which came about 7-8 months back and has saved a lot of people. And one injection a day for 7 days. It is only in the hospitalized patients. Along with that, we give some Magnex, Fort, etc., then vitamin C, etc., and steroids if possible, and oxygen if necessary. We check their saturation. Sometimes people's oxygen saturation can drop from 100 to 94 is okay, 96 is okay. But if it comes to 85, 80 or 78, etc., then he may need to have an oxygen and need to have probably hospitalization. In the quarantine patients, we don't give any medicines much. Only give them an antibiotic called azithromycin, which covers sore throat and body ache, etc. Paracetamol, which is a crocin, and also vitamin C we give, and some multivitamin, etc. Ask them to take a lot more fluids. 2 to 3 liters of fluid they should drink every day, because hydration is important in these aspects. People have been talking about variants and other things, why the second surge, etc. When we have a lot of population in the markets and trains in groups, and half of them not wearing mask, etc. Wearing a mask is very important. We've been wearing that for a whole year now. Not only everywhere, but also because when a person with the positive when he coughs, when he exhales, the virus can come up to 2 to 3 feet, etc. So keeping a little distance is very wise, that it will not happen. And a mask which can be permeable for oxygen. Do not use any fancy masks with valves and sticking thing out of this one, that one. That's all useless. Already ordinary, what is known as N95, which is the prime standard of 3-4 layers of cloth which has been stitched into. Now, Well, the other day I saw one delivery boy in our lift. He didn't have a mask, but he was wearing a loose towel around it. It was hardly doing anything. It was almost on his chin, and he had it tied up at the back. We see such people, a lot of people moving around like that, but that is not an effective way of doing it. A proper mask should be worn when you are outside, when you're walking.
Right.
The variations, I talked about the vaccines. I talked about since now a lot of people with when the oxygen saturation falls will have to be in the ICU. You cannot be in the ward. There, so some of them may go on the ventilator, and a good number of people on the ventilator are very sick, and a lot of them die on the ventilator. That's what happened a few months back. But now we don't see much severity of these type of infections. And so what the message is this, that if you have any symptoms, you must get medical advice and get checked up and do an X-ray test as well as a RT-PCR. That is the test that is done. And if it is negative, that's good. You are cleared. And if it is positive, and if you have symptoms, you get admitted. If you do not have much symptoms, stay home. Traveling now, going to Kerala 7 days, short trip, there is no quarantine there. But coming back to Maharashtra, they'll ask you to do the RT-PCR. Gujarat also is now introduced that flying patients or people coming in should have an RT-PCR test done. That is a swab test in the throat. The international travel, again, RT-PCR is done here and there. When they arrive in the international, they do that. Now, gatherings. Now, any gathering above 50 is seen as harmful. Now, at one time at St. Paul's Marthoma Church, where I go in Washi, we had up to 100 people were attending it to a month back, And but now restrictions have been put that this week, coming week, only for 45 people at a time. So numbers in the church gatherings have to be for less than 45. And and their numbers, and as they come in, we write their mobile numbers, and their details are recorded in a register. And they'll strict masks have to be worn, as well as some distancing. You cannot have 8 people sitting in the bench. You can have maybe 2 or 3 only in a long bench. So that's how the distribution has to be done. And also holy and other gatherings have been very much restricted and cancelled in many places. So I can take questions. If you have any interest in anything, you can ask. It doesn't matter. The question doesn't have to be very intelligent. You can ask also some foolish things also. I don't know.
Okay. Thank you so much. Thank you. I think, Doctor, I would really like to actually begin with the foolish question, because this is a really bad rumor, unhealthy rumor that is going around in Christian groups. It is so foolish, but you have to answer it, because you are the authority on this, and people need to listen from your mouth. That the vaccine has got a 666 mark on it. And people should not. And this is, I was so horrified to see, but this is floating around in many Christian groups, and quite a few Christians are resistant, and even some of these pastors are declaring don't take the vaccine. So would you please clarify that?
See, when the vaccine came first day to all over the country, it was well secured, and it was specially transported, and they were from reputed companies, and they were made available on the same day. So we all health workers were the first ones to get vaccine, including doctors, nurses, and aides, and other people, and administrators, or whoever was in the hospital, health sector people were given. So we all took, and almost 60% of the health workers have taken it all over the country, I think. And some of them have not taken, probably availability or whatever it is. Some have not taken, but I took the vaccine, and I took the very first day it was available, and very first day the second dose was available, we took, and we were one of the early ones. And it's now more than 6 weeks after I have taken. About 60-70% of our faculty, all of them have taken. Those who have not taken are because who probably had some infections and they had to wait, and some who have a severe amount of diabetes or whatever is uncontrolled, they were waiting to control, etc. Above 60 was the first cutoff, and we almost had 250 people every day coming into these private to the DY Patil second floor. And now the government vaccine is now government, it's free, but in private hospitals it is 250 per person to be paid. All you have to do is show your Aadhaar card. Now the second group was 45 plus, which have been that those with diabetes, hypertension, and or comorbidities could take the vaccine. All over the world, people, if 45% of the British people can be vaccinated, 37% of the 230 or so many million people in the US can be vaccinated all over the world. And they have been yearning and asking for vaccines, which India itself was kind enough to give it to Ethiopia or Bolivia or whatever smaller countries, etc. And they are waiting for vaccine to come, and it is not available in their local countries, and the US and others also exported a lot of things. The rest of it, Pastor, this is like I have heard that, I'm sorry to say that some Pentecostal, some evangelical groups will not allow people to take medical treatment. And there was a time when children were deprived medical treatment because of the foolish behavior of these people. So there are people who are not very intelligent. Paul talked to Corinthians about the false teachings that was going on in the church. He was very much concerned, and he wanted that to be controlled. And he talked about the discipline in the church, and this is gross indiscipline. If they do not take the vaccine, they are harming the others who they are coming in contact with.
Of course.
There is something known as herd immunity, which can be achieved in this nation only if everyone takes the vaccine. Half of them taking vaccine, the half are walking around without vaccine, means the dose without vaccine is going to get infected. They're going to have resistant ones, and they're going to harm the others, including the children. So far, children and young people have been spared, and because their immunity is good, and we don't see them getting infection. But there is a plan in America. President Biden wants from May onwards is a universal vaccination. They are going to get children, young people above 16 or whatever it is. They are going to be vaccinated. So, Pastor, I cannot say. I cannot only say that these are foolish people who have their own doctrines and their own way of putting misunderstanding among people. We can't help them. Foolish guys are everywhere, whether they are pastors, whether they are doctors. There are doctors who have not taken vaccine. We have seen a lot of them there, because they have their own way. But it doesn't have any universal truth in this. So please, I will ask them to be careful.
Right, sir. Right. Thank you so much, Doctor. I think one of the questions that has come is here in the chat group is, what are the symptoms of COVID? I think it would be the same, right? What you already explained in the talk. Yeah, it would be the same.
Main thing is the fever. If an unexplained fever comes up and continues to be the few days, you wait a few days and see with paracetamol. If it doesn't settle down, that's one. Unexplained body ache. You feel tired. And bad sore throat. A lot of people come with cough, severe cough, continuing cough, and is not controlled also. So and that some people have diarrhea. Because the virus has entered the respiratory tract, it has gone into the gastrointestinal tract, and it produces diarrhea, unexplained diarrhea. So we have seen patients with diarrhea becoming positive. So some of these are some of the facts. And sudden unconscious stroke, then blood clots in the legs, producing phlebitis and etc. Are some of those symptoms.
Right. Yeah, I think one of the things I would just like to highlight what Doctor mentioned earlier was that even normal exhaling, when people are breathing who are COVID affected, and if you're going into the marketplace, they will that range can be 2 to 3 feet. So one needs to be very careful and wearing the N95 mask. I think because with time people are becoming casual and they want to enter into the market, and we need to be very careful. Thank you, Doctor, for bringing that up.
Some of the masks are not covering the nose. Masks are sitting on the chin.
Correct.
That's a fashion. And then again, the mask is sitting on the lips, Oh, that's also fashion, to the things. Yeah. Yeah. And
Yeah,
yeah.
yeah. I think they.
Any of these objectors to vaccine, we also want to ask them whether they were wearing mask or not,
Yeah,
Yeah. I have not seen the virus, but I
yeah,
have not seen we have seen a lot of symptoms.
yeah.
But whatever we have seen, we have never seen that 666 or whatever you mentioned.
Yeah. Yeah. Yes. This is a time open for questions. Please, I have few questions lined up. So if you have anything, please go ahead and ask.
Doctor,
Yeah. Yes.
doctor,
Yes.
after taking the vaccine, the first vaccine,
Yeah.
why
Yeah,
some people get fever, that
yeah,
reaction,
yeah.
fever, vomiting,
The,
and some people don't get anything. They're just
yeah,
very
yeah.
happy that nothing happens. Why it happens like that?
Yeah, it depends on your immunity level. It depends on your health level. We have taken, when I was young, we've taken BCG, we have taken smallpox, we have taken
Yeah, yeah,
hundreds of vaccines. We have taken, no. So those days
yes,
also, we also had some fever and pain
yeah,
and
yeah,
hair,
yeah,
etc. So it's only any vaccine can sometimes give a little bit of local reaction, pain in the muscle area, or
yes,
some
yes,
fever, etc. And
Correct, correct.
but people with previous comorbidities, very severe diabetes, very severe asthma, very severe hypertension. All these people can sometimes get small symptoms after the vaccination.
Right, right,
Now that is the only explanation, and there is no they've not established any allergy for these vaccines. So
right.
so some people get it because of their general condition is very poor.
Yeah,
People like,
yeah,
Norway, 25 people died at a time, etc. But they were all very old people, all moribund and lying in the beds and not moving, etc. That type of population.
yeah.
So people who get probably are the ones who would, even on an ordinary flu, they will get very sick.
Correct, correct.
That type of patient. So that's the only
Right.
explanation there. There's no definite,
Okay.
yeah,
medical
All right.
indication.
All right.
yeah,
Thank you, doctor. Yeah.
yeah. Thank you,
Any,
doctor.
anyone else? Any other question, please? Yeah. This is your time. Quickly. Yeah.
And now they have extended the time. They said
Uh,
Yeah,
first 28 days after
yeah,
the
yeah, yeah.
first,
Yeah,
after 28 days.
6 to 8 weeks after the first vaccine, you can take it anytime.
okay. Okay, doctor.
It used to be 4 weeks. We all took it 4 weeks, but now it's probably they're thinking 6 weeks is better. 6 to 8.
Right, doctor.
Yeah, yeah.
Yes, doctor, there's a fear that some of these vaccines have not been tested enough. Is that fear
No,
valid?
no, 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 no. Yeah, Covishield had enough level 1, 2, 3 done.
Okay.
Covaxin didn't have the third phase done, but that has all been completed in the last 3-4 months. So
Okay.
all the vaccines have been now trialed out. So there's
Right.
now there are others coming out. Reddy's laboratory, that laboratory, this different vaccines are coming into the new into the market.
Right.
We do not know about them, but Pfizer used in America and Covishield used in Europe and here, and Covaxin. These are the three common vaccines
Yeah.
available, and
Yeah.
only the last two are available in India.
Correct.
So what is important is take
Yeah.
the available vaccine.
Whatever. Yeah.
Yeah,
All
if
right.
you get 70%,
Yeah.
70%
Yeah.
protection, that is better than no protection.
Correct. Yeah. But doctor, given a choice between Covishield and Covaxin, it's better to go with Covishield, right? If there's a choice.
Yeah, we have been
Because- yeah.
giving Covishield, but in between the stock came down, so 1 week they gave Covaxin, and
Okay.
JJ Hospital has been giving Covaxin, so it
Right.
really doesn't matter,
Right.
whatever but the
Yeah.
dictum is available vaccine, you can
Correct.
get it faster, you
Right.
do that.
Yeah. Doctor, what about the Johnson vaccine that is coming up? That is a single
Right.
shot. Any
Yeah.
comment on that? Yeah.
Yeah, still we get it, we do not know yet, but if it's going to be a single vaccine, that's very convenient. See, we have covered only 5 crores. We've got 120 crores to still cover. So we need all the possible different type of vaccines at different levels and for different types of people to
Correct.
cover.
Yeah.
Correct. Yeah.
Pastor, I have a
Yes,
question. Can I ask?
Go ahead, Anjali. Yeah.
Okay, so hello, doctor. My name is Anjali.
Yes.
Actually, what happened was since 3-4 days, I've been having fever. And I've been taking Dolo tablet because my mama is a doctor and suggested me the tablet. But
Yeah.
then the fever comes and it goes, and then it comes back in the evening. I have a little cough. So should I go get tested? Because I'm just very scared.
Yeah.
I don't know what I'm supposed to
Yeah.
do.
these times, it's very difficult to differentiate between viral fever or ordinary flu or anything else other than this. So when you have fever, which even after taking Dolo, Neuro, etc., have not improved much, and you still have other symptoms like mild cough, etc.,
Mm-hmm.
it's better to get it checked. And
Okay.
yeah,
Right.
Because there
first,
was raining in Pune, and that is the weather is changing. I was staying in Pune, so my mama told it is viral because of the
yeah,
weather is changing.
possible. But viral fever normally 3, 4, 5 days it should settle down. But
Yes.
if it doesn't settle down, get it
Mm-hmm.
tested. No, it's a small
Okay.
thing.
Okay.
850 rupees only now it costs for the RT-PCR to be done. And if
Okay.
it is negative, you are much relieved. For example,
Yeah.
3 pastors from Washi Church, one of them one of them became positive, the other 2 were negative. So until you do the test, we do not know.
Okay.
And yeah, so it depends on the
Yeah.
severity of the symptoms. So
Yeah. Just face your fear, Anjali. Straight up.
Yeah.
Okay. Yeah. Sano, you want to ask something?
Yeah,
Yeah.
doctor, I felt like someone whom I know that like their family, the husband has symptoms and they went for test and then he got positive. So the whole family went for test and the daughter and wife, they don't have any symptoms, but they also test positive. And now they are quarantined in a and kept in the common like ward. So I'm just wondering, is that advisable? I mean, it seems there are so many people together and they
oh
don't have any
yeah,
symptoms.
yeah, in the ward it's okay, general ward it's all right, because there's a distance of 4, 5 feet between the beds, or 6 feet or whatever it is. So that's not an issue. And once you are positive, you already got the virus, so you're not going to complicate further with you cannot have more from some other person. So, but children cannot be in the adult ward. They have to be in their separate ward, etc. And so, if the symptoms are very little, then you don't get admitted. You can stay home also. Home quarantine. Hospitalization will required only if you have severe fever, severe cough, diarrhea, body ache, etc., and your saturation levels are lower.
Correct.
Oxygen saturation comes down to below 90, 85, 83, and all that. Even with oxygen is not improving, then you need a hospitalization and oxygen saturation.
Right. Right. Yeah. Yeah. Yeah.
Thank you.
Thank you, Sano. Doctor. Yeah. All right. Is there any other question anybody wants to ask quickly? Please go ahead. This is your time. This is your opportunity to clear your misconceptions or clear your doubts. Anyone wants to ask? Please go ahead. Yeah. Uh, Doctor, how long these vaccinations are supposed to be? The duration is supposed to be for life?
No, no,
Uh,
no. We do not know yet, because this is a COVID-19. It just came in 2019.
Correct.
Nobody knows what is going on.
Right. Right.
And, we are all assuming that is good
Yeah.
for next 6 months.
6 months.
Yeah, maybe another spate of vaccinations will have to be done. We don't know, or 1 year. We do not know. So
Okay.
as it is, probably they are talking about 6 months protection for
Right.
for these people. Yeah.
Yes. And you do require to still be careful after taking vaccine, right? You still
Of course,
require.
of course,
Yeah.
of course.
Yeah. Yeah. Yeah.
You do vaccination, you do the second one,
Yeah.
and you have to still wear your mask and keep distance, and wash your hands properly, and stay away from crowds, etc. And we every today also I did a bypass surgery. Every day we do
Yeah.
surgery, so we take all the possible precautions. We
Right.
have these patients tested, RT-PCR negative, HRCT negative, all sorts of negative
Yeah.
tests are still done, so that we do not transmit to others and we do not get it from others.
Yes. Yes. Yes.
So even after vaccination, that's what the
Yeah.
advertisement says. No, wear your mask and do your all precautions. What is possible.
Correct. Correct. Yeah. Yeah. Doctor, how does a person decide? How does a person come to know if he's asymptomatic or if he is healthy, and he wants to distinguish between like he's not having any signs, but he or she is learning that there are other people who are going to get tested. How does an asymptomatic person actually come to know whether he's got COVID or not if he's not showing any symptoms? Is there any way to
Normally,
know that?
normally those without symptoms don't get just checked at all.
Okay.
But they will probably have a cough, and about 4 or 5 days, nothing is settling down. Or
Okay.
like the Anjali said, no, she has fever, not settling down. Or,
Correct.
then only you go and get it tested. Or
Right.
you
Yeah.
had a family member who was severely sick, and then you are
Yes.
staying with them. And if they are severely hospitalized or something, then you may have to be tested.
Correct. Correct. Yeah. All right. All right. Yeah.
And if you do not have much symptoms, you don't just test at all. You cannot. That
Okay.
is like any other ordinary person. No, you are just checking them.
Yeah.
It may become negative, but you may have some surprises also. A lot of asymptomatic people are also positive.
Yeah.
So it's a difficult area.
It's a
Just to
difficult area.
decide, it's up to you. Yeah.
Right. 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 Yeah. Doctor, how long do you foresee? Okay. Anybody else wants to ask a question quickly? Because there are some questions lined up. Anybody else wants to ask? Please go ahead and ask. This is your time. This is your opportunity. Please go ahead. If you're having any doubt, yes, Jacob. Yeah. Okay. All right. Okay, fine. Anybody's trying to say something? Your mic is not here. Okay, fine. All right. Doctor, how long? How long do you think this battle with COVID will last in this nation globe? How long do
Yeah.
you foresee this?
Today, we're from Jeslock Hospital. One of the doctors were talking on that CNN 18 channel that when they had some flu 100 years back or whatever, there were 3 levels. First one, second one, and the third surge. So now COVID is now putting up to the second stage in surge in many places.
Okay.
So we do not know how long this will last. Maybe a few months, 2 months, 3 months, and then maybe a third stage even afterwards. So
Okay.
many people think life will be the same till the end of this month, end of this year.
Okay.
Yeah.
All right. Okay. 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 Doctor, is it true that the new strain is resistant to the vaccination? Is there any truth to it?
No, there are 2-3 strains and a few strains which we do not know, and they found something in Pune here and there, but the information is very, very, very poor.
Very poor at this stage.
We don't worry about it. We be responsible people. Take care of yourself. That is the only thing we can do.
Correct. Correct. Yeah. So, doctor, we are still supposed to go ahead and continue those tablets, the zinc tablet and the multivitamins.
That gives you, Syncovit and all this gives you a little protection, vitamins. Improves your immunity. Yeah.
Correct.
Also take care of your personal hygiene,
Yes.
And don't overeat and, keep clean. These are important here.
Right. Doctor, the zinc and multivitamin have to be taken together, or it's either zinc or multivitamin?
No, any combination of any multivitamin is good enough.
Multivitamin is good enough.
Yeah, they say vitamin C 500 is also good.
Right. Okay.
And liberal use of paracetamol. If you have fever, you take paracetamol.
Correct. Okay. Okay, friends, we are almost coming to the close. If you have any question, any doubt, you can ask even on behalf of somebody if you're concerned. This is at your time and opportunity to interact with Dr. James Thomas, who's a brilliant, resourceful person God has placed. Please go ahead. Don't hesitate. This is your time to ask questions, please. Yes, anyone? Okay, because afterwards, when I close only, then they say, "Oh, I wanted to ask, and you closed." That's always something. Somebody is just waiting for the last minute only. Yeah. Okay, Doctor, the Johnson being a reliable brand, and since it is convenient having a single shot vaccine, I think it is coming out this week. Would it be wise to? I mean, would it be better to wait for it and go with that? Isn't it?
If it's available, you can take it. They'll put it in the market only after the trials. So once it is in the market, means it's safe to take.
Right. Yes. Okay.
Because there are so many people, and they still need to be vaccinated. So the more the merrier. The more centers, the more they're talking about societies coming into societies and giving vaccinations. So these steps are going to be happening soon.
Correct. Correct.
So yeah. So as I said in the beginning, whatever is an available vaccination
Yeah.
for you, you should take that.
Correct.
And don't wait for this and that. 70%, 80% doesn't make any difference, So,
Right. Right.
so yeah.
Yeah. Okay. Thank you,
Good.
doctor.
Thank
One
you.
of just one personal, question in terms of what I've observed in people around because of certain weddings that have been held up for so long. And now that the lockdown has been opened up, people are rushing in for weddings. And also, there are definitely unfortunate situations like funerals that happen. And then there are also some of the elderly people who travel quite a distance for medicine or checkup, which they need to do it. And then they do end up traveling in the local train also because the trains are there and the government, at least in Mumbai, has made it clear that there is not going to be any lockdown. So in such scenario, what should be the priority? What people should watch out for? Because what I have come across is, जो होना है होके रहेगा. We can take care of ourselves. We try to take bath and we try to manage things. But nonetheless, people are taking, even senior people are taking risk. They are going out. They are maybe, of course, the funeral and all is there, or sometime for a medical checkup or going the distance, like traveling all the way to Mumbai in the local train. Is it advisable, doctor, in these times? Can you just be little firm and
No,
the answer?
the dictum is travel only if you must,
Okay.
and avoid as much as possible crowds.
Local train.
Local trains are difficult. If you have to go by local train, wear a mask properly, and stay away from somebody who's coughing or sneezing or whatever it is. So that is the precaution that you can take. Coming to hospitals, it's not a difficult, but only thing the traveling part, maybe keeping them in buses, etc., may be a difficult situation. Interstate travel has to be avoided as much as possible because there are some states who have more cases, some have less, and they are trying to restrict that. And funerals, marriages, etc., numbers have to be really. Government has already told that not more than 20 for funerals and 50 for weddings.
The age limit.
But people keep on having 200, 300 guests, and so that is irresponsible because the control is not come. If people do not behave, will not listen, government will be forced to do all sorts of measures.
Right. Doctor, since you are also a believer, also a spiritual person, along with being a doctor, one of the mindset that I come across is people saying whatever has to happen will happen, and no matter how much care we take. How would you respond to that?
Yeah, well, God expects us to be responsible people.
Correct. Yeah. God will take care of us.
God has given no. God has given us intelligence. He has given us how to demarcate evil from good things, how from right and wrong, etc. And more than animals, you have been given an intellectual capacity.
Absolutely.
I think God expects us to use our knowledge and our respective in the right way, not in the irresponsible way. There was a Presbyterianism, Baptism, and all Baptist theology, etc. I do not know. But one thing you can say that it is foolish to say that what will happen is happen because God has given you the opportunity and the thing to be responsible. That is a pretty big. If you cannot be responsible to yourself, you cannot be responsible to others.
Right.
More so, professionals, doctors, pastors, etc., to behave properly because they have been given more opportunity to interact with people.
True.
So, what will happen will happen. God, naturally, even if you do all the things, if you are going to die, that means God has destined it. You can say it like that, But foolishness. Paul has said that foolishness is not required of believers. You have to use God-given intellectual your capacity and the ability to differentiate. Use that. So don't just sit there and go and sit in some
Okay.
big marriage and say that you got
Yeah.
in. God has given me that.
Correct. Yeah. I mean, the tendency is to put the God in the dock. God will take
Yes.
care of us. You don't worry,
Yeah.
Pastor.
Yeah.
Yeah. So
No.
as I mentioned, questions will pop out at the last minute. Here, there's one in the chat. Somebody has asked that their dad is 89-year-old. Should I take him for vaccination as he's also on other
Sure.
medicines? So he's weak and he's
Yes.
also
Why
on other
not?
medicines.
108-year-old lady the other day had a vaccine. No. So
Correct.
vaccination will help everybody. And
Right.
older age has no contraindication or opposition to the use of vaccine. No. If they are
Yes.
healthy enough, are they mobile? They are moving. If they are bedridden and bed sore and that sort of situation maybe has to be assessed. But a mobile, healthy person, even if they are 90, should of course take the vaccine.
Right. Yeah. Okay, friends. Anyone else? Last, if you've just entered, anybody wants to ask question, this is your
Yeah.
last chance and opportunity. Yes.
Yeah, we can
Okay.
stop now.
Yes. That's all.
Okay.
That's all.
They
Thank you,
had
doctor.
enough of me.
Doctor actually was only giving 15-20 minutes, but as usual, he's gracious and he manages to always give more for us. So God bless you, doctor.
Thank
Big
you.
thanks from all of us. Yeah.
Yeah.
Take
Thank
care.
you
Thank you
very
so
much.
much,
Thank you.